go.
Sorry, I didn't know you were taking a picture.
Okay, so first what your name is and where you work.
Okay. Tiffany Ham, Hyperbaric Oxygen of Kansas City, and the Wound Healing Center.
And what hospital is that?
St. Joe Health Center.
St. Joe. Okay. So my question for you is, we are interviewing nurses to find out, to get your feedback as far as, advice that you would give to new nurses about avoiding litigation and ways to protect themselves.
Okay. Well, first off, ways to protect yourself from litigation would certainly be knowing your material, obviously, following protocol, hospital protocols, company protocols, and then the most important thing would be charting, is documenting everything, place, time, amount, who gave you the order. I mean, everything. Safety, any kind of safety teaching, especially education. Make sure you document that, because when you go back, if a litigation or suit is filed, that will be the only thing that you might have as proof of what you did and what you can remember. So charting, I would say, would be the most important thing.
So when you say safety and education, you mean safety and education that you've given to the patient?
Exactly. So,
okay.
For example, you something as simple as you return the bed rail to up position. Mm-hmm. You know, that you might be in a hurry and you want to get home, but you really, if you are taking care of a patient who has a fall risk, you have to be thinking in that way of all the safety things that you did, because when you go back and someone's questioning you about that chart, I don't remember, but if I wrote it, it happened.
Okay.
So,
okay.
Everything relating to that patient for safety.
Okay.
They're looking for negligence, so you gotta protect yourself.
Okay. And then, would you, as a nurse, recommend that nurses get liability insurance once they get, their own personal liability insurance when they get out of school and go to work for somebody?
I wish I knew more about this topic. Where I work for a group of physicians who own our facility and carry liability on their employees for those types of instances. Had I not had that, I would not carry liability insurance for myself, because as I've understood, if you have liability insurance, they're going to go after the liability insurance, and if you don't have insurance, they're not going to come after the nurse as much. Now, we're talking about in situations of negligence. If there is some sort of purposeful harm, then that would supersede anything. Mm-hmm. But in instances of negligence, I probably wouldn't carry my own. But I haven't researched it enough.
Okay.
So since I have it, I guess if they told us they weren't giving it to us anymore, I might do a search on it and see what the National Nurses Association or BNA for our group would suggest.
Okay. Great. Thank you.
Thank you.
Cool. Thank you.